All right, thanks. Any other things you could do on the front end to maybe prevent this situation from happening in the first place?
Well, we discussed about defining the expectations right at the beginning.
Mm-hmm.
To give them actually an objective to accomplish during the shift.
Yeah. And if it could be, oh, sorry, go ahead.
Whether it be, cognitive or procedural or whatever.
Mm-hmm. Yeah, and if it could be student-driven too, that's all the better. Something that they're interested in.
So I was over there to step up, but why not also kind of explore what is the interest of the rest of the students?
Mm-hmm.
Is there something that he wants to? What is he going to go into? What
Yeah.
are his goals? Or maybe focusing those 4 weeks in something that he is going to get something out of it. Not only that, you also can demonstrate what should be the interaction between those two specialties.
Mm-hmm.
I think that we also do a great service in the future just by modeling what we want those services to interact with us.
Absolutely. Yep.
What I was going to say is, so we actually do something very similar. So as soon as I get applicate when I start, that's actually one of the goals of rotation. Some of it is procedures, some of it is, I'm going to be a resident in 2 months, or something. I say, or it's just, you want to pass, it's fine. But you got to have goals for it, so that way when we meet with them in rotation, we pull that sheet out and say, okay, are you meeting the goal? If you're not, how do we get you to meet that goal? The other thing that we did is, because there are some areas or some departments where it's kind of easier to kind of quote-unquote hide from students that are less engaged, is so we actually assign them directly to a faculty member or a resident. So, that resident, so saying that, if Will's on shift, he's got enough student, he knows that student's assigned to him, he's there to help that individual. They're like, we used to be on our lead side where they would just sign up for whatever patient's available, staff it, whichever attending was available. Depending on the flow of the department, sometimes they end up pulling on those patients for 30 minutes, you're not staffing it, or the faculty may be a little less engaged. Now we actually say, this student is yours, we'll open more.
All right. So just know the benefits of having non-EM rotators, both to the student as well as to yourself, and then really have a plan like we've been talking about, setting and communicating clear expectations, having a good attitude, using those learner-centered approaches, optimizing the learning environment, and fostering intrinsic motivation. Any questions about non-EM rotators or other pearls that you guys want to share? So we'll move on to thinking about some active learning strategies in the clerkship. And so who has didactic activities as part of their clerkship? Okay, great. And so how do you all feel about that? Are you using active learning strategies? Yeah, what are some things that people are using?
We use a lot of SIM.
SIM.
Paired with our didactics.
Mm-hmm.
So, especially with ACLS or resuscitation specific, and then using our SIM language on, and then using appropriate feedback and closed loop factors.
Great. Other people?
Doing it online, used to something I think rotations of an online discussion group.
Okay.
Two faculty for each of these rotations, these students posing questions at the end of their day.
Great. And so we'll really talk about, what are active learning strategies, and then sort of present a menu of things that you can do either yourself if you're giving the didactics, or also help to develop your faculty. If you have faculty who are doing a more standard reading from a PowerPoint, like how can you help them make that experience more interactive? And so I like this sort of the stage on the stage. The teacher-centered approach is kind of that classic lecture in the big lecture hall. And it used to be, this was the main mode, and it was really designed to transmit information because the teacher was the expert, they had all the information, and the best and fastest way to get it out to the world was to come and listen to somebody talk. But now with the internet, and people have access to the information, and so really that's not, the teacher's not needed for that anymore. And so now it's more about being the guide on the side and being learner-centered and really helping facilitate the learning process for the student. And I like this quote because it really helps to remind me that learning is a process, it's not a product. And so learning happens in the mind of the learner, we cannot see it happen. We infer that it has occurred because they produce some product or performance that we infer to have demonstrated the learning. And so we can't make learning happen. We can only create conditions that hope to foster learning, but you can't force someone to learn. And so I think for me, framing it sort of that way helps me to think just in more broader terms about what we can do to encourage learning in our students. And there's still some benefit to classroom teaching. It doesn't mean that it needs to go completely away. And it may help to develop knowledge base, explaining difficult concepts, develop higher order thinking. And this is probably one thing that I really like to use it for, is to help facilitate transfer to other contexts and problems. And so, letting students, show what they know, but then how can they use that to solve or find solutions to new clinical problems. And it's an opportunity for collaboration, developing shared knowledge, and also the metacognitive aspects of learning, like teaching them, how to learn and guiding them through the actual process. And just in general, good principles of instructional design as you're thinking about developing more classroom-based activities is to make sure there's congruence between the learning objective, which you want the person to learn, and how you're teaching it. And so if you want them to be able to, using the SIM example, run a resuscitation of a patient in cardiac arrest, well, you probably just can't stand there and talk to them and tell them, this is how you would do it. You have to have an experience where they actually have the opportunity to do that. And you want to use multiple instructional strategies to reach all the different learners. And think about your resources. Sometimes I get really excited when I hear about all these new ways to teach and these great instructional strategies, and I'm like, I'm going to do it, right? But I'm only one person and I don't have a budget, right? And so I can't maybe do all these things because I don't have the resources. So thinking about, what is realistic and what can you do where you're at. And so starting sort of from the lowest hanging fruit is maybe you have this lecture, you're like, man, I want to try and make it more interactive, but I don't have a lot of time to change it before I have to give it next week. And so some simple things you can do are pause procedures. And so the 1-minute paper where students write, just for 1 minute about what they learned to help consolidate the knowledge. You can do a muddiest point. And so after you talk, ask students to write down, what's the one thing that was most confusing to you? And then you get that quick feedback and you're like, okay, every student said, understanding the anion gap was the most confusing. So it lets you know you didn't teach it very well and can give you the opportunity to kind of go back and correct it. Using case-based scenarios, and these can be used at the beginning to sort of capture attention, in the middle is sort of to break up material, or like we did last time, sort of at the end to kind of consolidate and apply the knowledge. Commitment exercises, you're the best. All right. Thanks. I feel better not being chained behind the podium. So, commitment exercises, which is what we actually started this whole thing out. Some introductions, and then who has this kind of clerkship, who has that. Trying to find ways to get people engaged early. Concept maps. And so this is an example we do in one of our courses where it's for a patient who has an acute ingestion. And so we ask people to sort of map different concepts. And so they're thinking about, how things are linked and what they're going to do. And you can just have them do this, de novo, like you could do COPD and CHF and have them think about linkages. Or you could provide them with a partially filled out map to kind of, allow them to fill in the missing spaces. And then utilizing social media. So are there ways to engage students outside of the classroom? So an online forum or a tweet chat or something like that that you would be able to do. And these don't require a lot of restructuring if you already have lectures. They're just little things you can sort of sprinkle in.
Be careful with social media. Just be aware of your institution
Policy.
Policies. We had I'm happy to give you my mistakes so you can learn from it. We had a social media platform called Edmodo. I don't know if anyone's ever heard of that. It's used primarily in kind of K-12 education. And our medical center had an account. And so we decided we were going to
maybe talk to somebody who's done it successfully before, and people who maybe have not had as much success, and learn from what well and what doesn't go well. Sort of this next group, I think about like quick additions, and so it takes maybe a little bit more to change the structure of a talk that you may have, but you don't have to totally redo your instructional materials. And so the think, pair, share, asking people to think about something, talk to someone else, and then share into the large group can be particularly helpful if you have sort of the quiet learner, because they do have the opportunity to voice their opinion with just one other person, and then you can try and encourage them to share to the whole group. Role play, it's sort of like social media. Like if it's done well, it has a lot of potential. If it's done poorly, it can go south pretty quickly. And so just thinking about the appropriate place for that. Some debates, and so maybe there's, some hot topics. We've talked about, Narcan, should or shouldn't it be given to patients? Should it be free? All those kinds of things. And setting students up to think about and talk about those things. Educational games, and so there are a lot of serious games out there that you can use for teaching. We use the game Emergency, which teaches some of the basic principles of operations management. So the students get to build an ED, and they simulate 24 hours of patients coming through the ED, so they get to see how their ED actually performs in response to volume and things like that. And so there's lots of opportunities out there to include that. And then Snowball is sort of one of my favorite. And so basically you can set up a couple different ways, but you can ask a question and have people write answers, or you can ask the students to pose a question on a piece of paper, and then basically you crumple up the paper and you sort of throw it into the center of the room, and then everybody grabs a paper from the center of the room, kind of like a snowball fight, and then there's something actionable on that. They either need to respond to what's on the paper, answer the question, or find somebody else, but it's just a fun way to kind of get people up and out of their seats and moving around. And so these I think of as like lecture alternatives if you were totally like, no more lectures, no more PowerPoint, what can I do? And so one is the flipped classroom. Does anybody use this currently? Okay, so a couple of people. What's that? For residents, yeah. And so really there's some pre-class assignment where the student's supposed to learn the content. It's asynchronous. They do it independently. They bring that knowledge to the classroom, and then they do some kind of application synthesis exercise together in a cooperative manner. And then there's supposed to be post-classroom learning, where it's a sort of deep self-directed learning where they go deeper into the topic. Ways that I've failed in this or seen it not work so well is if the pre-class stuff isn't set up well, and so you can't just say like, learn about chest pain, right? Like having a more directed, reading guide or some objectives from that reading, and also giving students the time to do it. And so you can't just flip the classroom to put more time into your rotation. Like you need to give them the time to actually do the pre-work. And then you can't forget about the post-classroom learning, because that's part of the process too. And so a lot of times I've seen it where it just stops with the classroom learning and then it's like supposed to be done. And so really that post-classroom is also an important piece of things. Next is team-based learning. Anybody use team-based learning? Oh, good. And so this is usually done in 3 phases. There's the preparation phase, which is, again, it's sort of individual guided learning. Phase 2 is the readiness assessment, where you do individual tests, team tests, and there's discussion, and then there's some type of application exercise. And so it's a fun way to learn material for students to engage cooperatively in material. It does, I don't know about your all's experience, but it does take some time to set up. You have to have sort of the right topic, the right room structure, and again, just making sure that there's time for the students to do that preparation for it. And finally, problem-based learning or case-based learning, where the students get some kind of problem assigned. The group really identifies what they need to know. They sort of work to learn it, and then they come back and solve the problem. This usually works best if it's facilitated. And it doesn't necessarily have to be somebody that has the content knowledge, but just somebody that's good at facilitating group processes can work here as well. So why don't we just take a few minutes and think about kind of the activities that you guys currently have and ways that maybe you're either interested in making things more interactive, or share maybe some of your best practices in adding, the flipped classroom or team-based learning into your clerkship, and sort of what has made those things work and maybe what hasn't gone so well, so we can kind of learn from each other here. And we'll take just a few minutes to do that.